Mycobacterium tuberculosis is the causative agent of tuberculosis. It is a non-motile, rod-shaped bacterium and an obligate aerobe. The cell wall is acid-fast and does contain peptidoglycan, which makes it stain a weak gram-positive. The high content of mycolic acid in the cell wall contributes to M. tuberculosis virulence and protects it from phagocytosis.
3000 BC. Physical deformities of characteristics of TB in the spine are portrayed in drawings, pottery, and statues of ancient Egypt. 460 to 375 BC. Hippocrates, the father of medicine, believes TB is caused by growth in the lungs. He calls tubercula. 1800 to 1850. TB is the deadliest disease in America, responsible for 1 in 5 deaths. 1882. Robert Koch, a German microbiologist, presents evidence that TB is caused by M. tuberculosis. 1907. Clemens Furier Baron von Perke is the first to use tuberculin skin testing in humans. 1920. The use of chest x-rays to help diagnose and assess TB is well established. 1928. The League of Nations certifies that the BCG vaccine is safe for use in humans. 1943 to 1944. Selman Waksman discovers streptomycin. A year later, it is given to the first patient. 1970s. Multi-drug resistant tuberculosis are described. Tuberculosis is rare in the Soviet Union. 1979. The TB epidemic is in New York City. 1985 to 1992. 20% increase in the rate of TB in the U.S. 1993 to 2003. The rate of TB in New York City begins to decline. 44% decline of TB in the U.S. 1997. Multi-drug resistant TB is in every country surveyed by International Union Against TB and the World Health Organization. 2003. 7 countries offer collaboration of TB/HIV activities in response to high rates of HIV/TB co-infection. 2007. The United States reports lowest rate of TB ever. Done.
Hi, I'm Christina.
Hi, Stephanie.
Hey, what are we seeing you for today?
Well, recently I haven't been able to get over this cough that I've had. I've had it about 3 weeks and I just can't get rid of it, and I've been having fever and chills through the night, but mostly it's my chest. I've been having like a tight chest pain. I've been feeling real fatigued lately. I've had to call into work a few times, and I actually have had like a loss of appetite, a little weight loss, not too much, but enough to where I can tell.
So mostly the problem has been like a really bad cough. You've had it for
Almost a month now.
Okay, is your cough dry or are you spitting up a little?
It's kind of wet. Actually, I actually have coughed up a little blood it doesn't happen very often, but I have seen a little blood in my mucus, kind of.
Okay, I'm going to go ahead and just take your blood pressure and listen to your breathing, and then we'll just go from there. Okay, Stephanie, there's a little bit of crackling when you breathe.
Is that bad, or?
It's not necessarily bad, but we do want to go ahead and get you to radiology to get an x-ray to see what's going on with your breathing. We'll give you a call, and
do you think it's pneumonia, or?
It could be pneumonia just from there being so much fluid and coughing going on. We'll just give you a call with the results.
Okay.
Thank you. Hi, Stephanie. I'm sorry. It looks like you're still not feeling better.
Yeah, I'm spitting out blood, actually.
Well, we did get your x-rays back, and you definitely have an infection. I'm going to go ahead and do a tuberculosis skin test. You'll just, come back within 3 days, and we're going to take a look at your skin. just to see what's going on, okay?
Okay, so what is that, like a shot? It's a
Yeah,
shot?
it's a shot.
It's a shot in my butt?
No, it's not going to go in your butt. That's the good thing today. No, not going anywhere near your butt.
Okay.
Okay. All right. Well, if you'll just go ahead.
Where is the shot?
Oh, it's going to go in your forearm. Okay.
Okay.
Not your tush. Okay. If you'll go ahead and roll your sleeve up for me, please. I'm going to get some gloves on.
Okay, what do I do about the dot? Or that bubble?
It's going to make a bubble. You're going to just go ahead and leave it intact. Don't rub it. Don't scratch it. We're going to try not to burst it. Come back at your convenience. It just has to be within 3 days, okay?
Okay.
That's it. Thank you.
Thank you.
Hi, Stephanie. How are you?
I'm still sick.
We're here to go ahead and take a look at your TB test. Let's take a look.
It's a little poofy and red.
Yes, it is. It does look like a positive result. I'm going to go ahead and take a measurement. Okay. And since it is a positive result, I'm going to go ahead and get our TB specialist in here to just have a talk with you to explain your treatment going forward and what we need to do, okay?
Hello, good afternoon. I'm Teresa. I'm the TB nurse. How are you, Stephanie? How are you feeling?
Still sick.
Still sick? Okay. We did get a positive TB back from your results, and your chest X-ray showed the same thing. We're going to start off with isoniazid. It's a 9-month treatment, and that will be taken daily. But first off, we're going to send you off to get blood work done because isoniazid is strong on your liver. We want to make sure your liver is.
Okay, what exactly is this TB?
TB is a lung disease, and you could get that from like a foreign country. Someone you know might have active TB, and it spreads from one person to another.
Can I die from this, or?
If you have the full-blown active TB, the TB is fatal.
Can I stop it from progressing?
We're
What
going to
is
do
this
the
medicine?
isoniazid to stop it from becoming really active. We're going to do the 9-month treatment and make sure and get it well under control. Any other questions you might have?
So I can never get rid of this?
Sorry, unfortunately it's not curable, but we can control it with this medication.
So as long as it's not active, as you say, I should be okay.
You should be okay.
As Stephanie comes to the realization that she's infected with tuberculosis, she makes a desperate call to her mother.
It's not curable. They told me I might die. Okay. Okay, Mom. Bye.
Poor Stephanie here ended up having a form of multi-drug resistant tuberculosis. This is a form of TB that is resistant to 2 or more primary drugs, such as isoniazid or ripronephrine that are used for treatment. There is another form called extensively drug-resistant TB. This is a TB resistant that is at least resistant to isoniazid and ripronephrine among the first-line anti-TB drugs and is resistant to any fluorocobaline and at least one of the 3 second-line injectable drugs. Now, what multi-drug resistant TB means is that The TB is resistant to one or several forms of treatment that occurs when bacteria develops ability to withstand antibiotic attack and relays that ability to its offspring. The entire strain can inherit the capacities to resist effects of various treatments, and non-resistance can spread from one person to another.
Now.
9 months later, what are you doing? Individual results vary based upon adequate treatment and can be fatal.
Dun dun dun.
Treatment for MDR-T.
My life's going down the toilet, just let that come off.